Hi, I'm Dr. Dionysius David. I'm a general dentist, and I'm recording here at one of the clinics I work at, Expressions Dental. Today we will be describing to you the dental procedure extractions. So let's start off. What is an extraction? An extraction describes the process by which a tooth is removed from a patient's mouth. Why is an extraction done? Well, it boils down to three areas. They're either due to infection, due to being unrestorable, or orthodontic reasons. Infections can be within the tooth itself or from the gum supporting the tooth or the bone structure. If the cavity, or caries as a dentist would call it, gets too large, it can infect the living tissue, the pulp of the nerve tissue of the tooth, and then a tooth might abscess requiring extraction. Similarly, in the bones or gum supporting the tooth, they can be infected and the tooth needs to be taken out as well. Going for unrestorable, when we talk about unrestorable, it means the structure has been compromised to a point where it's not able to be fixed. For example, is a vertical root fracture, where the tooth is split in half and goes down the root. There's not enough tooth structure above the gum line to support a filling or restoration. Or finally, due to parafunctional habits. Now, the last category is orthodontic reasons. Sometimes when you go see an orthodontist for braces, they recommend to have a tooth extracted. And the reasons for that is either to make more space so the orthodontic treatment can proceed, or after the treatment, such as for wisdom teeth, which allows to help prevent relapse. The final thing that you should be aware of with any procedure is that there's always inherent possible complications, and a further list should be discussed with your healthcare provider. So, for example, I usually boil them down into two categories. For the extractions, you have things that involve post-surgical healing. So when the extraction is done, that includes things like you may have bleeding afterwards, you may have an infection, there might be things like bruising. Those are some examples of what that is. Also, teeth or structures beside that tooth may be affected by the procedure. The supporting bone may be fractured. Fillings or teeth adjacent to where the teeth are taken out may be fractured. The second part now is who performs extractions. There's three categories of people that perform extractions in Alberta. It is a general dentist. That is a person who's gone through a specific 4-year training program at a dental school. The next is two classes of specialists. We have periodontists who have gone and done approximately a 2 to 3 year program after dental school and specialize in particularly extractions, but mostly in the areas supporting the teeth. So the bone, the gums. And finally, there's an oral surgeon. He's the most qualified. He's gone through a specialty training program in which he's done an additional 4 to 7 years of a hospital residency, in addition to his dentistry education. For a full list of these things, definitely talk to your dentist. I hope this helps you today in understanding better what the dental procedure extractions entails, and thank you very much for your time.